everybody! This is Aditya Said. Welcome to my channel. So now, I'm going to show you how to perform the Leopolds Maneuver. So first, let's define the Leopolds Maneuver. So, this is the standard palpation of the abdomen for assessing the fetal position, presentation, and degree of descent. So the purpose of this, first, to determine the number of fetus, to identify the presentation, position, degree of descent, and attitude of the fetus. Lastly, identify the point of maximum intensity of the fetal heart tone in relation to the woman's abdomen. So the equipments needed for this, first, the pillow, the tape measure for measuring the fundic height, and the stethoscope for the location of the fetal heart tone. So, before doing the procedure, first, check the client's chart, read the doctor's order for the said procedure, client's condition, and restrictions to ensure that you're administering the procedure to the right client. Second, do client's assessment, obtain obstetrical history including parity, gravida, score, LMP, EDC, and AOG, and measure the fundic height. To gather data would make computation accurate. Last, take the vital signs. To baseline data prior to doing the procedure for comparison purpose. Third, explain the procedure to the client. To elicit cooperation of the client, it reduces apprehension and encourages cooperation. Hello, Ma'am. Good morning. I am Aditya Said, your nurse for today. May I know your name, your birth date? Let's obtain your obstetrical history. So, is this your first pregnancy, ma'am? How many child do you have? When is your last menstrual period? And now, let's measure your fundic height, ma'am. So first, for the scene. Ma'am, I need to measure fundic height using this tape measure. I'm going to measure, ma'am, your fundic height. So, your fundic height is 37 centimeter, which means the age of gestation is 37 weeks. I am here to perform Leopolds Maneuver. I am going to palpate your abdomen to determine the position, attitude, and presentation of your baby. Is that okay, ma'am? But first, we need to empty your bladder. Do you want to go to the restroom, ma'am? Gather the needed equipments and check for its completeness. To be organized, promote efficient and time management. So here are the equipments needed. First, the pillow, the tape measure for measuring the fundic height, and the stethoscope for the location of the fetal heart tone. Do hand washing prior to procedure. To do hand washing deters the spread of the microorganism. Provide for the client's privacy. To ensure the cooperation of the client during the procedure. In doing the proper procedure, place woman in a dorsal recumbent position or supine with knees flexed or to relax abdominal muscles. Drape the clients using the top sheet or blanket, exposing only the abdomen, and place a pillow under her head. So I'm going to position you in a supine position. To have easy access during the maneuver, to make client more comfortable and gain cooperation. Make sure that the hands are warm before coming in contact with the client's abdomen. Rub the hands together vigorously to prevent uterine contractions and use the palm with the hand instead of the fingers. To prevent starting the client and to produce warmth. Using both hands and facing the client, feel for the petal part lying in the fundus. Determine the shape, size, mobility, and consistency of what is being palpated. For the findings, head is more firm and hard, round that moves independent of the body. Breech is less defined that moves only in conjunction with the body. To avoid overreaching of the client's abdomen, enable to palpate the fundus and feel the parts lying under. One hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly on a circular motion from top to the lower segment of the uterus to feel for the petal back and small petal parts. Use gentle but deep pressure. Repeat this step on the opposite side using the opposite hand. For findings, petal back is smooth, hard, and resistant surface. Knees and elbows of fetus feel with the number of angular nodulation. To use both hands in palpating, aid in correction findings during the second maneuver. Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and make gentle movements from side to side. The usage of thumb and finger would help in the determination of the presenting part, either engaged or not engaged yet. Facing foot part of the woman, palpate petal head pressing downward about 2 inches above the inguinal ligament. Use both hands. For findings, good attitude if brow corresponds to the side, second maneuver that contained the elbow and knees. Poor attitudes, if examining fingers will meet on obstruction on the same side as petal back, hyperextended head also palpates infant's anteroposterior position if brow is very easily palpated. Fetus is at posterior position, occiput pointing towards woman's back. Place client to its proper and comfortable position to make client relax after the procedure. And do hand washing to prevent the spread of the microorganism. Document the procedure and assessment during the care. A careful record is important for documentation of their client care, reporting, and recording of information about the procedure must be accurate and timely for continuity of care.